Students are turning to alternative substances to have enough energy just to get through the day. From excessive caffeine intakes to turning to study drugs to stay awake, students are putting themselves at risk to achieve academic excellence. We met up with Dr. Kelli Stringer of Huntsville Hospital, who shared some information with us on the importance of sleep for students and the dangers of developing addictions to substances used to stay awake.
Caffeine, the biggest thing I think is it does affect your sleep cycle. It keeps you awake when you're not supposed to be awake. And in general, you can overdo the caffeine. There's a lot of caffeine in those 5-hour energy and energy drinks, monsters, all the things that kids drink and taste good. They don't often realize how much caffeine is in them, and that a certain amount of caffeine is good, but overdoing it is bad. And so I think that's where it comes into the balance, is the timing of the caffeine and how much you're taking. And it's available to kids, it's what's out there, and it tastes good, and they market well, and so that's what kids drink. So I think as a parent, being very cognizant of how much caffeine your child would intake, and I would say before high school, there really doesn't need to be any caffeine involved. Once they get a little bit older, you could allow some, but being very cautious about how much you allow your children to have.
Kids are being introduced to caffeine at a much younger age.
We see younger and younger children in the hospital, and they'll have a Starbucks at their bedside, where most children when I was little didn't like coffee and what it tasted like. So yeah, it is becoming an epidemic where children are being introduced to not only the sugary things that are in those caffeinated beverages, but the actual caffeine itself, and how harmful that can be to someone who's developing. And that can affect brain development, just as sleep can. If you're not getting enough sleep, your brain's not allowed to develop like it should, and that can affect all areas of your life.
Dr. Stringer also touches on the trend of students starting to use prescription drugs to stay awake. She says this situation can become very dangerous very quickly.
There are some times when pharmaceuticals can be used to help patients who need help staying awake, but the use of those without a physician is generally completely not advised. And really, you're going to do yourself more harm than good. Even if you are able to stay up and study for that test, or do really kind of pull an all-nighter to get things done, you're not going to reap the benefit of that in the long run. Those substances will harm you. They will change the chemicals in your brain and the way your brain works, and those things are harmful. So as parents, just kind of keep a pulse on what your children are doing and just know kind of what they are. And if you see signs and symptoms that their behavior is becoming more erratic, that you're finding things that may indicate that they are using substances, go straight to your healthcare provider and talk to them, and get someone else involved that can kind of be that third party and warn them about the dangers of drug use.
Putting the Valley first, Cindy Stallworth, WZDX News.